So all of the attendees may see a little pop-up box that just says, do you consent to continuing to participate, because we are recording today's information session. Once again, it will be posted on our YouTube page, and we will share out the recording link with all of the individuals that registered. Good afternoon. I know we have folks from 2 different time zones. We have folks on Central Standard Time and Eastern Standard Time. So welcome, welcome. I think it's afternoon for everyone, for most people. My name is Regina Knox, and I work alongside Sheila Plogger and Mary Glenn Rice, and we are on in the Division of Community Health at Marshall School of Medicine, and we will be facilitating today's information session. Normally we have these be, kind of informal. We're going to continue with that theme. If you have a question during today's information session, you can just use the raise hand feature. There should be a little icon that says reactions, or you can put your question in the chat box and we will make sure that we answer all of your questions. You can do that during the information session or wait to the end. So thank you so much for joining us. During today's information session, we're going to cover some key elements, which are listed on the screen. We're going to provide an introduction to Umbrella Hub arrangements. We're going to provide a brief overview of the Marshall Umbrella Hub organization, what our model is. We will explain the benefits of joining the Marshall Umbrella Hub. We're going to review the application deliverables in each of the components. We will review the budget and the funding guidelines, and also we will cover what the submission deadline is and how to submit the application. And then we'll just open it up for general questions and answers at the end. So I think most people on today's information session have heard of or have knowledge of the National DPP, the National Diabetes Prevention Program. The Umbrella Hub arrangement was created as a funding mechanism for small CDC recognized organizations, mostly community-based, that typically would not have access to billing for this type of service as far as a claim. So it's a way to help them get some of that health insurance reimbursement for offering the National DPP. So that's how the model is set up. It's set up to have a larger entity, a larger organization, for example, Marshall University, that serves as the hub for smaller entities so they can be able to bill insurance providers, for example, Medicare, Medicare Advantage, private insurers, private health insurance plans, to be able to bill for offering that National Diabetes Prevention Program as a service. Any questions about that? Because that's a really big thing. Typically, in previous years, we've provided funding and support to coalitions in the Appalachian Diabetes Network to train lifestyle coaches and implement the National Diabetes Prevention Program in their community. And the responses that we always heard back was it's really hard to sustain the program long term if you don't have a sustainable funding mechanism. So this would be the sustainable funding mechanism for those smaller community-based entities. And am I still sharing my slides? I lost power for a little bit.
Sorry, Regina. Yes, I was on mute. They look good.
Okay, let's see. I need to go back. Okay. We're talking about contracts and agreements. So a pretty significant portion of the Umbrella Hub arrangement includes various different types of contracts and agreements between the Umbrella Hub organization, for example, us, Marshall, that larger entity, and what between the subsidiary, we use subsidiary and affiliates interchangeably. It's just the coalition or the community-based organization that implements the actual National Diabetes Prevention Program, as well as contracts and or agreements with the billing vendor. The billing vendor that we use is called Weld, but there's several different billing vendors out there now that actually provide that type of service. And then contracts between the Umbrella Hub organization and each healthcare plan. And this has been a process for us. We are learning right alongside several other organizations in a demonstration project about how to best stand up the hub as far as building the infrastructure and growing it for sustainability in the future.
Hey, Regina, we have a question in the box. The question is, if we are currently not billing, does this mean we would have to bill?
That is an excellent question. And really, no, because the hub would bill on your behalf. That's the premise of the Umbrella Hub arrangement, because many smaller coalitions don't have the staff or the claim system or even the billing knowledge. That's something that we're still working on, building up our knowledge about billing for services, especially with the different health insurance payers. So this would be a way for your organization to be able to bill for offering the National Diabetes Prevention Program, but we would do that for you on your behalf. So no, you don't currently have to. It's best if you're not billing. But this is a way to sustain your program through reimbursements. Great question.
Yeah.
So there's a lot of service, a lot of contracts and agreements. I know it sounds like a lot, but really, this is a process that we're all working on together. We are currently the two subsidiaries that we have. We sent them the agreements to review. We are working with them in partnership with them to determine what's the best language, which agreements the language works better for them or better for us. And we just want to make it agreeable to where all parties are benefiting. So we can definitely walk alongside you as you think about what those agreements look like. We have those agreements on hand. Weld has a master service agreement. So we will provide those for you and your organization to review before signing. And like I said, we're still working with our current affiliates to determine what needs to be in those each particular agreement.
And we have one of our subsidiaries online with us, and we're going to ask Julie during the question and answer session just to kind of give a little bit of feedback and her feel about her experience with being part of this agreement.
Okay, this next slide talks a little bit about Marshall University's Umbrella Hub model. Since we are participating in a demonstration project that's funded by the NACDD with funding from CDC, we have our own unique model that we've developed. Our hub is actually made of two entities. It's the Marshall University Research Corp, which is the academic arm, and Marshall Health, which is a healthcare system arm. So we are partnering together, the two separate entities, to actually develop the infrastructure for our Umbrella Hub. So as you can see, the different boxes at the bottom, this is the entire plan. This is all we're doing. We're developing the infrastructure, which we've already done that. We're currently testing the reimbursement and payment model. That's entering the data into Weld, which automatically generates claims, working with our subsidiaries to help them with any recruitment or retention activities. And then what we really want to do is build build a hub up, increase the number of affiliates, increase participants, so we can sustain the program long term. Because really, if you think about it, really at the grassroots level, this reimbursement model will help communities sustain their national diabetes prevention program long term and not rely heavily on grant funding, which we know is not reliable, or even like, I know we don't want to penalize people and turn them away if they're unable to pay, because that's the population that we serve. They're low income, rural communities. So we want to make sure that we're offering a quality service to them, but we also want to be compensated for it so we can keep the program going. So that's been a challenge for previous coalitions with this particular program. So our business model is depicted in this diagram. So we have the different payers who cover the National DPP as a covered benefit. We definitely know Medicare does. Some Medicaid and MCOs offer coverage for the National DPP. Some have identified other suppliers that offer the program that they require their beneficiaries to work with. And then we have private insurers, like health insurance plans, like specific, like we use PEIA. I don't remember what that stands for. It's a state teachers retirement plan. So each health insurance plan covers different items, different services. So we will work with the payers who cover the National DPP as a benefit. We will submit claims to those payers on your behalf. You will receive reimbursement for those claims. And then we do have a 20% indirect or administrative fee, just at the cost of doing business, the cost of running the hub, the cost of processing payments. Right now, that's 20%. The 80% goes back to you as the subsidiary or affiliate. It comes back to you to put back into programming, so you can use that for, running your program, class recruitment, retention, anything related to your particular diabetes prevention program.
And Regina, we have another good question. Will the DPP participants ever have to pay anything out of pocket?
Well, I will say that at this time, there is no copay for Medicare beneficiaries, but that may not be true across all health insurance payers, but I know that there's no copay for Medicare beneficiaries.
Thank you.
That may change in the future. I know the physicians' fee schedule has changed several times, in particular with this program, but it's been going in the right direction. So they've been increasing the amount of reimbursement, because we all know, if you don't know, this is a 12-month program. Retention for most programs is about 50% attrition. So typically, if you have a class of 10 people that start out in the first week, on average, you may lose at least half of them. And so the way the reimbursement works is you want to keep people engaged. There are performance measures that payers do look at that will impact the reimbursement rate. For example, people have to come to class. Number one, they have to come to class, and they need to reach performance measures. For example, weight loss is one of those performance measures. Decrease in A1C, that's one of the performance measures. So they want people to not only learn from the information that's shared in the class, but they also want their numbers, their A1C to decrease, their weight to decrease over time.
Thank you, Regina.
You're welcome. Any questions about this business model? Nope. Okay, the next section talks about the deliverables. So what are we asking the subsidiaries to do? In general, I would say in general, as it relates to this application, and all of this information is on the application, along with links to additional resources. But in order for your program to be successful, you really should have more than one trained lifestyle coach to facilitate the classes. For billing purposes, lifestyle coaches will need to register for a national provider identification number. That's free to do, and we will provide you with all the information on how to do that. But you would need to have trained lifestyle coaches to facilitate the classes, and they would need to register for that national provider identification number that's required. We actually complete the necessary paperwork with the CDC to join the hub. So each individual subsidiary is their own entity. The benefit of the hub is that all of the subsidiaries share their recognition status of the hub. So in previous, if you go about the regular way to become a recognized CDC organization, you would submit all of your paperwork to the CDC. You have to have so many, I think it's 5 participants that complete the class in order to keep your recognition. It was really hard to do for small entities. This way, we're all sharing participants across the hub. So the more participants we have from each subsidiary, if we lose some, like I just talked about that attrition, it decreases the impact of losing people on the recognition status, because it's all aggregate. The data is all aggregate. So there is a process, application that you will submit to the CDC that you want to join the hub. Another benefit for becoming a member of the hub is that you no longer have to submit your 6-month data reports. We will do that on your behalf. We will work with you. We can pull reports easily out of WELD of all the participants. We ask the subsidiaries to check that data to make sure that it's correct, and then we upload that to the CDC on your behalf. On our previous slide, I did talk a little bit about the contracts and agreements. You would need to contract with our billing vendor because we are sharing individual level data for participants. That there's claims information in there, the individual's date of birth. So there's very sensitive information that would be subject to HIPAA laws and regulations. So we do ask you to complete a contract with that master agreement with WELD. We ask you to complete affiliate and business associate agreements with us. That will come from Mary Glenn. We actually implement at least one cohort during the funding period. So this funding period started on August the 1st, and it goes through July 31st, 2024. We're hoping that new subsidiaries would be able to start classes in January of 2024, so we can further test the reimbursement model. So being able to implement classes that first part of the year, would we could submit claims and hopefully get reimbursement back out to you to continue to test the model. And then participate in our UHO cost study analysis, because we really want to know how much does it actually cost to implement this program, not only for the hub as the administrative costs, but for you as well. So how many participants would you need to have to receive reimbursement for to cover the cost of the lifestyle coach, any printed material, recruitment and retention items? So what would be that break-even cost? So we would know, and then you as the subsidiary would know what that number should be, so we can work on a plan to make sure that each subsidiary is successful. Oops. I think I was going the wrong way.
Okay.
Is that it? I think so. Nope. I have one more slide. Sorry about that.
That's okay.
Okay. Additional deliverables that we ask is that each subsidiary participate in a sustainability planning session that includes a projection tool to determine current and future costs. I just talked about that. We also host monthly meetings with the subsidiaries. It's just so we can share successes, lessons learned, any barriers, and how to overcome them as a team. We do a lot of peer sharing, peer networking on those calls. We talk about insurance providers, because we all are working on limited knowledge. We do a lot of self-study with this particular project. So if you don't know, we have access to lots of resources to be able to find out answers to help you be successful. We also ask that you complete and submit a financial expense report at the end of the funding cycle. So the application includes a budget form. So you would fill out the budget form, and then if awarded at the end of the fiscal cycle, we're just going to ask you to submit. It's a one-page expense report that Mary Glenn is going to go over later on in the presentation. And then commit to sending at least 2 people to an in-person kickoff in Huntington, West Virginia on November the 9th. And so that's a cost. The travel cost can be included in your budget, which Mary Glenn will go over. We will notify you of the time and location of the meeting if your application is accepted. So I'm going to pause there and see if anyone has any questions about the deliverables. I'm checking the chat box.
I don't see anything in the chat box yet.
Okay.
Okay, so we'll move right along. And I'll talk a little bit about some of the components of the application. It's pretty basic, of course, like most applications, no more than 5 pages, double spaced, with a font of 12. But we ask you to describe your population of focus for the National DPP and your need for expansion. Descriptions may include target populations with a higher prevalence of prediabetes, underserved or high-risk populations based on gender, age, race, income, Medicaid eligibility, cultural community, and geography, meaning like rural locations or locations with limited access to programs. And circling back to where I was talking about those high-risk populations and gender, the CDC states that more men have prediabetes than women, and that communities of color and low-income populations have a higher risk for type 2 diabetes. So, that may be your target population that you would want to focus. And then we would like for you to describe your geographic focus, where you plan to deliver that program. That could be at a community center, your health department, one of the organizations that you might be partnering with, but we'll ask for that as well. And then we'll ask for you to describe your implementation approach for expanding or creating your program. You may want to partner with organizations that already interact in your priority population once you know who those people will be, such as the community health center, health departments, things like that. These partners can be a really good source for referrals, and they can provide insight on how to best reach those target populations as well. And then number 4, describe your sustainability for the National DPP. Community partners play an important role in supporting the sustainability of your programs. So in some rural communities, partners provide in-kind contributions such as transportation to and from diabetes education classes, your physical space, program activities. And then sustainability also depends on the ability to continue to engage those folks and new patients. You may find those folks at your schools, the senior centers, and that type of thing. And then finally, describe your efforts to address health equity barriers during your program recruitment and implementation. So for example, target your outreach efforts to reach your priority populations that you've identified. For example, there may be folks who are of low income that may have low literacy levels. And so some of your marketing messages or your curricula may be geared more toward those with low literacy. Any questions about that? And Regina, you can take us on to the next slide. And we'll talk a little bit about the components here of your application before Mary Glenn takes us into the budget. But the first part of it is just basic, your contact information and things like that. And then we want to know, does your organization have trained lifestyle coaches? Or do you plan to have lifestyle coaches trained? And Regina had mentioned before that we're requiring at least 2. Life happens, and this program is a year long, so it's always good to have a backup, regardless really of any program you have. But this program in particular is good to have at least 2. That way you don't carry the burden alone. And then we want to know, how many cohorts do you anticipate implementing by July 31st, 2024? And the cohort, of course, is defined as a group of individuals that will be in that 12-month program. We also want to know approximately how many participants you anticipate enrolling for that year. And then some other basic information. Do you have a referral system? Do you partner with those folks that could, like a physician, for example, could write referrals to your program? Also, we want to know if you have a physical agent. Most folks do, and Mary Glenn will talk a little bit more about that and some of the paperwork and things that will require moving forward once your application is accepted. And then we also want to know if you've ever implemented the National DPP, and if there were any barriers or challenges to that. And that really kind of helps set the stage for the technical assistance that we can be able to help you guys with along the way. And trust me, I promise you, we do a lot of hand holding. Some of you may know us and worked with us with Marshall before. And that's what we do. And I think that's one of our unique skills, is just to kind of help you along through the process and providing you the resources and training or anything that we can possibly help make your program as successful as possible. Any questions about that? Regina, I see that you put in the chat box there the list of approved lifestyle coach training providers. So
Yeah,
thank you for that.
There are 13 approved training providers. I did notice that there's an entity that's not on there, that offers lifestyle coach training. That's DTAC. They're out of Emory, but you can just click on that link and go to any of those providers, and they can, on their website, so they'll let you know if they offer in-person or distance learning or hybrid or combination thereof, and what the cost is of those particular lifestyle coach training programs.
Thank you, Regina. And then I think Mary Glenn is up next, and she's going to walk us through the budget and all that kind of good stuff. I'm sure you guys are interested in that.
Hi, good afternoon, everyone. I'm Mary Glenn Rice. I'm the grants manager within the Division of Community Health for Dr. Deb Keister and this awesome team. And I'm just going to kind of go over briefly the budget form that's within the RFP. And it's really a very basic one-page budget form that we would like for you to complete that lets us know how you would be spending your $5,000 mini grant / funding. And so basically the allowable items for spending obviously would be personnel, as well as your NDPP lifestyle coaches time. And you would just briefly give us some detail and then include the amount, as well as travel. The travel, we hope that everyone will be able to attend our in-person meeting in November. And the travel expenses that are typically approved and are allowed would be the cost of either a rental car and gas for the rental car, or your mileage reimbursement from your personal vehicle, as well as if you're traveling, a distance and you need to stay overnight, lodging and your meal per diem. And feel free to reach out to me or Regina or Sheila if you want some assistance in completing or finding resources to be able to provide those budget estimates. I'm here to help. I'm here in the office, and feel free to give me a call or email me, and I am happy to go through this and provide assistance as well as resources. And we also allow for expenditures on programming materials and supplies. A really nice benefit would be using your funding for a scanner. I know oftentimes organizations need scanners to scan those health cards, and this funding could purchase a scanner for that very reason, as well as we've been given the go-ahead most recently from our CDC counterparts that you can use a portion of your funding for incentives such as pedometers, measuring cups, scales for weight, as well as scales for food, and then other items that would help promote healthy lifestyle activities. And after I go over the budget form, I would be interested to hear about other incentives that this group knows of that might be helpful to share with one another to encourage participation. We would welcome that. Another item is technology. Folks often need funds to purchase Zoom and other platforms for video conferencing, as well as video cameras. You can use your funding for office supplies, marketing and publication costs. I know a lot of folks use Constant Contact and Canva to create electronic newsletters to get the word out about their programs and trainings. So this could be another way to purchase those expenditures. And then others, if you have other needs, feel free to reach out to me or Sheila or Regina and just check with us about if other items that you might need are acceptable. And then we also, after you complete the budget and submit it and you're approved, we do have to obtain approval from our funding agency, the National Association of Chronic Disease Directors, NACDD. So we would be confirming that. And another issue too, or not issue really, but another item I'd like to just go over is if once you complete your budget and then you determine later that you have other ideas or something didn't work out or purchases are not gonna be able to be followed through. If you have any type of budget amendment or budget modification, if you could reach out to us first and go over that modification and just discuss it with us and let us know about that and give you the approval, we would appreciate that, because what we are going to go by with your budget is what you have submitted. So if you have any type of modification, we are here to work with you on that modification and help you in any way we can. We want to make this as simple as possible, but if you could at least notify us of your modification first and let us know and give you an approval and heads up, we would appreciate that.
Hey, Mary Glenn, we have a question in the chat box, really a comment. Healthy food prep, lunch and learn recipes and things like that, in regards to the budget allowable items. Can you address that?
Healthy food prep. I'm not exactly familiar. Could you elaborate on the healthy food prep?
Yeah, so that was
Is this something? I wonder, is this something?
Yeah. So
yeah, is this something like Hello or the actual food service?
I'm not sure. Casey, you were the one that put that.
Hi, I'm sorry. You had mentioned something about incentive items that might be beneficial. I know in the past when we offered the course, we had an individual come in and do like a little healthy food prep. So that's all I was meaning. I'm sorry, I wasn't very clear.
Oh, no problem. So hi, Casey. Thank you for your question. I think your suggestion. So I'm assuming this is a demonstration that you do in-house.
Yeah, it was actually I forget the name of the organization, but it was Josh Sowards. I don't know if you all remember.
Yes,
but
I know Josh.
Provided a little tutorial, and it was very simple. It was just cutting vegetables, how to do that, and made it simple, and then used, $20 worth of Aldi groceries to make a breakfast or a healthy snack and a lunch, and just how you can stretch your money, but then also have something that's filling and friendly for that population. So I don't know, it was just a thought that came to mind. Thanks.
I think it's a great idea. Typically though, with federal funds, we aren't allowed to purchase food, but I am happy to check on that with our agency, with our funding agency, because I think it's a great idea. And I'd be happy to check on that and see if that would be an approved expense.
I was thinking more along the lines of, and that's fine if that's what you choose, but I was thinking more of just maybe if someone wanted to do it on the side as an incentive, kind of sign up for a little lunch and learn or a little tutorial, and then maybe not use those funds, but somehow provide that in addition, I guess. I'm sorry.
Right. No, I can check on it and I'll be happy to get back with you. How's that sound?
Thank you. That's fine.
Great idea.
And then we have another question in the chat box. And the young lady asked, just wanted to clarify that if accepted into the Marshall Hub arrangement, are we given a $5,000 budget for the mentioned expenses?
If you are accepted, if your application is accepted, you will receive $5,000, and this budget form helps determine how you will spend the $5,000, and that's why we are kind of going over this form. And we're happy to help you complete the form. But we just need to know exactly. There are some items that are not allowable per federal funding. So we just need to make sure that you are, you're spending properly and that we are allocating your funding properly.
Can I add something? So
Certainly.
So we know that $5,000 is nowhere near enough to actually, develop a quality program, but the goal is to help you grow your national DPP through the reimbursement process. So think of this just as like a startup amount of money, a mini grant to help you get started, and it's up to you and your coalition, your community-based organization on what that would look like in the future. How many lifestyle coaches you have, how many classes, how many cohorts, how many participants. So there's a lot of potential for you to be really successful with this program through the reimbursement model.
And if I can add one thing to that too, is when you're thinking about this program, think out, think into the future with who those partners that you want to bring on board, those organizations to help support you, like through that referral process. If you partner with a provider or something like that, you've got kind of these referrals coming and going, and you can expand your program. But like Regina said, it's really like a startup budget, and we're really going to try to help move you forward and do, like I said, a lot of hand holding and things. And we'll also hear from Julie too, who is one of our subsidiaries at the end during the Q&A, just to kind of give her, and she's been with us now since the beginning, so we'll think of this really as some startup funds, really to get you guys started. But, this is it's a year-long project, but we really are excited with, just being able to, this is new. When you think about it, reimbursement for the National DPP. Yeah. So, it's all very new and innovative. So we're excited that you guys are all here.
Yes,
Absolutely.
Absolutely. And then lastly, I'll just add that towards the end of the grant period, we will also be sending you a financial report, and we just kindly ask that you complete the report and let us know if how you've spent your money. It's particularly according to your budget, and that you have expended as well. So, and then we just need that completed and signed and then emailed back. And it's a one-page form. It's very simple. And as always, you're welcome to email or call me if you have any questions regarding the form.
And we have a great question from Susan. Is reimbursement throughout the year or at the completion of the program? Any idea of the rate of reimbursement?
Excellent question. I'm going to put a link in the chat box. Reimbursement happens over the course of the 12-month period, and it's based on the physician's fee schedule. So for example, we can bill after session 1, after session 4, after session 9, and then the reimbursement will change based on if the person met their attendance and weight loss performance measures. So they get more money if they met, 5% of their, if they lost 5% of their beginning body weight. So that's when it becomes really important to help your participants walk alongside them in their wellness journey. If they're having barriers with losing weight or maintaining, a physical activity routine that works best for them, that's where the lifestyle coaches come in to kind of help them track what they're eating, their physical activity, to figure out what works best for each individual. So I'm gonna put that in the chat box, then you can look at it. Right now, the current, the maximum amount you can receive for a participant that does everything right, completes the program, I think is $780. So just, put that in perspective. If you have 10 people, they all complete, they all meet their weight loss goals, you'll get about $780 over the course of that 12 months based on the fee schedule. Great question.
Yes. And then our submission deadline is 5 o'clock Eastern Standard Time on September the 15th, 2023. There is a link that Regina's going to put it up there, but there's one on the application that you complete. It's a fillable form, but remember to download that to your desktop after you have completed it, because it's not going to go to us online. So once you've done that fillable form, then save that to your computer and then download it and email it to Regina. And anywhere along the way that you guys may get stuck or have any questions or anything like that, feel free to contact us. And now we're going to open this thing up for some questions and answers. And we'll give Julie, too, an opportunity to kind of just tell us about your experience. So we'll open it up first for questions. You guys are welcome to open your mics if you want to speak and shout out your questions.
I do have a question. The deadline's not very far away. And if you do not have any trained lifestyle coaches, you can go ahead and submit the application, and as suggested by Regina, I think begin it in January. Is that correct?
Well, hey, that's a great question. So, because if you don't have any trained lifestyle coaches, they'll need to be trained first. Typically, that's a 1-2 day, with some organizations, a multiple week process. So in order to give you some time to get your lifestyle coaches trained, if you don't have any trained, you'll have, September, October, November, December to figure out first of all, who's going to train them, how to get them trained so they can be ready to start a cohort in January.
Okay, so you don't have to have them trained to do the application.
Correct. You can actually use some of that funding to pay for the lifestyle coach training because it's not typically free. There's normally a cost for that. However, we've been talking with our friends at the CDC, and they're trying to work out a deal where we can send affiliates that are members of the hub, anybody who wants to become trained as a lifestyle coach. They're trying to figure out a way to do that for us at no cost. So we'll let you know how far that goes. So we just started talking with them about that.
Okay, thank you.
You're welcome.
Susan. Other questions?
I have a question.
Okay.
That's okay. So I currently offer mine online. Would that be accepted as part of this model?
That's also a good question, and a question that we're waiting for additional clarification on. As a part of the public health emergency, which impacted this particular program, they did make allowances to allow us to submit claims for people who participated via distance learning. Now, prior to COVID, you only can get reimbursement for in-person classes. So the public health emergency has been extended several times. On this version, it's been extended to December 31st of this year. Our question that we are currently waiting an answer from is what happens if the public health emergency is not extended past December 31st and we have cohorts that start in January that are distance learning? Can we still bill for those participants? So at this time, we don't have a definite answer, but absolutely yes, right now, up until December 31st.
So that wouldn't impact the application form at this time.
No, it would not, because I mean, when Julie is able to share her experience, she has been talking about expanding her reach through distance learning. Some people have transportation barriers. Some people, their schedule won't allow them to come to a class in the evening. So some people prefer a distance learning format, but prior to COVID, this program only allowed in-person classes. So we're just waiting to hear a response for them for what happens with the billing portion after December 31st.
Okay, but this wouldn't start till January the 1st, is that correct?
Well, we are anticipating, if you don't have trained lifestyle coaches, that it's going to take you several months to get those lifestyle coaches trained. So we're just throwing that out there, that a good time to be able to start a cohort or a class, if you don't have already trained lifestyle coaches, would probably be January, because we do want to have sufficient time to test the model. So starting a cohort at the beginning of the year would allow you time to get your lifestyle coaches trained, get all your materials to be able to start in January. That's not a definite, that's just a tentative date for right now. It really depends on you, on what your National DPP looks like now, and when you want to start, how fast can you recruit participants? Do you already have a waiting list? Do you already have multiple lifestyle coaches? So it really just depends on each individual organization.
Right, and is there any number of participants that you're limited to? Because I know that when you have that question session, this was a while ago with the CDC, they said at one time they did, then they lifted that. So they didn't say, well, a maximum of 10, because that can sometimes be difficult time-wise if you have several groups. It does kind of impact, never mind the cost of paying another, lifestyle coach, right? So is there any limited amount of people per session?
No, there's not, because all of the data is aggregate. That's one of the benefits of joining the hub. You're no longer bound by that minimum number of participants. And I really believe it's 5 to maintain your recognition. So all of the data.
I was talking about more. I was thinking more of like per class. I probably wasn't clear, so my apologies. So is there a maximum per class for participants?
No, that's based on whatever guidelines you set for your individual program.
Okay, that's very helpful in itself. Well, that's been great. Thank you very, very much.
You're welcome. Thank you for your questions. Julie, are you still on with us? Do you want to unmute yourself and provide any lessons learned or share your experiences about being a part of the hub?
See Julie on there. I just don't hear her. I know she had a little trouble earlier, I think, with sound. In the meantime, there was a young lady that had needed the links again, where she had just she lost her connection, I guess, and needed to log back on. So I've gone in and reposted those. I hope that's helped.
And once again, this session is recorded. We will share out the recording link. It'll be posted on our YouTube page. You can share that with as many people as you like. Our contact information is here. You can feel free to reach out to any one of us if you have any additional questions, or if you just want to schedule like a separate meeting between our team and your team to kind of talk through the budget application, the budget or the application, or any ideas you're thinking about. We're pretty much informal. We're here to help. We're here to make sure you're successful. We want to make sure this program is available to a larger demographic population, and this model will help sustain the National DPP longer than it has been in the past. So not relying on 100% grant funding, but being able to cover the implementation costs of this program is really helpful for coalitions going forward. So you don't have to learn how to do anything with billing or anything with claims. It's all automated. It's really just data entry. The claims are automatically generated from the data that's entered into Weld. Is Julie able to speak? Want to make sure I still see she's muted.
Yeah, she may just not be able to get on with us.
Hear me now?
May I just, so I can get it clear in my mind, do a quick recap of what you just said, just so I'm understanding a couple of things with certainty?
Sure.
And I'm sorry to interject like that. My apologies. I just can't find where I raised my hand. So that's my issue at the moment. So I think this is great that you're helping with, all of these clerical or administrative tasks, because it can be quite overwhelming. And the funds are very helpful. But again, I'm really wanting to be clear about, we do our own marketing, right, to get our participants on board, and as well have an additional, at least one other lifestyle facilitator, which is fine. But in my thinking, I would have to be careful when I onboarded someone else, because I don't want them waiting while I get people together, right? While I get a group together, they could be waiting, and there might be, expectations of wage to some degree while they're waiting for this to start. So is there grace in that case of, okay, I've got some, engagement here and I'm ready to implement this, but maybe is it you have someone else, and do you need them? What if your groups are smaller? You're not getting the traction right away.
You know what? That is a valid point that you bring up, but we typically leave implementation up to each coalition or community-based organization. However you want to, whatever guidelines you want to set forth for your DPP or your guidelines. We don't have any standardized implementation model at the community level, because you know your community members the best. Like you just said, you do the marketing, you do the outreach, the recruitment and retention. So if you feel that you only need one lifestyle coach based on your population of focus, or you already have a plan of 10 people starting a new class every 3 months, that's great. So we just leave that up to you to determine.
Okay, because when you said have at least one other, maybe you're building, in other words, right? So scaling. And as you scale, you have a pool of people you can draw from. So that's what I currently do. I have a pool of people I can draw from.
Yes.
But, it depends on the numbers at any given time of participants.
Absolutely. What we found is that sometimes coalitions or community-based organizations only have one person.
Okay.
And so that person is sick or not able to facilitate a class, they can't help host a class. So we just want to make sure people are supported and have what they need. But if you have a pool of peers that can serve as lifestyle coaches, whether they want to facilitate their own class or serve as a backup, that's great. I mean, that's we leave that up to you. We just didn't want there to be only one lifestyle coach, and if that person leaves, then the program falls apart. So we always recommend you have at least two to keep the program going.
Okay, that's great. Thank you.
This is Julie. Can you hear me now?
Yes.
Wonderful. Well, it's been a pleasure to be with you all today, and I just wanted to share with the others that are thinking about this program. It is just a wonderful team I've had the privilege to work with over the last year or so, and the process looks a little daunting, but it is very smooth. Just working through that beginning stages of the contracts and getting things going. Maybe just to comment about something, a new feature that is coming when you were talking about recruiting. With our software platform, we are looking at a QR code that'll help and make that easier to market to individuals and get them to be part of your class and recruiting for those classes. So as we go through this project, there's new features that are being added and just making it a stronger program. So with my area, I am by day a healthcare worker, and then on the side I work with our coalition. And we see in our community, typically, you know, when you're working with a healthcare system, we're working through those physicians, and we don't really get to get out in the community and find the individuals that are really at need. So I think that's where our coalitions come in and can really reach out to the community and work towards this huge endeavor we have to reduce diabetes. And so I feel it's a wonderful process to bring those coalitions in, because we would not have had that opportunity except through public funding, and that is kind of hard to come by. So this really just allows us to be able to reach those communities. And with the reimbursement, I kind of look at it, when you look at those finances, I tend to be a financial person. Even if you minimally performed, that participant minimally performed, it's about $18 per session. So when you build your classes, you can kind of think about that for the cost of that class. So it is very helpful. And so you can have mixed classes, and as we work on those other payer sources, that you'll have a class of individuals that be paid through the fee schedule with Medicaid, Medicare, and then you'll have those commercials, and then you may as well just have some individuals that you have grant funding for those. So you'll have a mixture in your class that you can kind of budget for and figure out what that looks like for your expenses. If there's any questions for me that I can answer, but it's been a great process, and the team has worked hard to put the hub together and work through all those little issues to build this framework. And we're excited about others joining this team and being able to really pull information from each other. So as we grow this hub, we can seek out each one. And if you have an issue with a certain class or with recruiting, a team is there to help you. Sheila is wonderful about just thinking about other ways to recruit. I've had to lean on her recently, and she's given a lot of great input on looking for other patient populations that I just hadn't thought about. So it is a great team.
Thank you so much, Julie. And it's been a pleasure working with you. You always add value to our discussions, especially since you're a clinician and you have personal experience with health insurance payers, and we don't. So we've had to lean on Julie a lot with trying to teach us how it all works. So we really appreciate you.
Yes, you have truly been a blessing, Julie. And Julie is from Virginia. So yeah, so she's out of state and working with us. So for any of you folks that are working out of state that may be a little hesitant, oh, Marshall University is in West Virginia. You know, like I said, we are available anytime you guys need help, right through this process, you know. So you guys have questions, shoot us an email with your application, with your budget. Like I said, we do a lot of hand holding, and we're very thankful that we can do that. And we have the flexibility to do that. And so we really appreciate everyone that joined us today. And we look forward to your applications. And thank you all so much. Any final thoughts or comments, Regina, Mary Glenn, or any other questions?
I would just encourage you to reach out to our team if you have an idea. If you think you want to join the hub or you think you want to join in the future, just reach out to us and talk with us so we can kind of work through what your hesitations are. We can provide more information, more resources. We are truly learning together. Sometimes we ask questions that even like the CDC doesn't know. So we're all just trying to figure out how the hub can work best for everyone. So we really want to prevent the prevalence of type 2 diabetes. This is a way to do it.
Yes, it is.
Mary Glenn, you had something to say?
No, thank you all though for participating today. We're so happy that you're here. And as I'll just kind of echo what Regina said, if you have any questions, feel free to reach out to us, and we are happy to schedule a time to talk and discuss and go over your plan, go over any questions. We're here to help in any way.
Right. Okay. Well, thank you. Thank you.
We appreciate you. I did put the actual application in the chat box. I will add it there again for anyone who joined a little later. So you can actually download that PDF fillable application and get started. So we appreciate you.
Thanks again, everyone.
Thanks, everybody.
And I'll stay on a couple of minutes where until I upload that application.
Yeah. I'll hang out with you too, Regina.
Okay, you just
Bye.
hanging out. Thank you. You have a good afternoon.
Bye, everybody.
I'm staying on for that application.
Okay. All right. Thank you, Anita.
And it is in the chat box.
There it is. I see it. So we're gonna hang out until everybody gets off, just so that you can grab that, right?
Now, the problem is if I grab it and it's unsuccessful, I lose you. I think that's what happened to the other
Oh, okay.
person. So that's what happens in Zoom. I use Zoom quite a bit, and not maybe everybody, but many of us have that challenge, right? If it's not preloaded. So I'm just afraid if I go to download it, I'll lose you, but I'm glad I've got these emails, because I would like to reach out and ask them just about this signing up. I really would like to sign up. I mean, I really would. But I just have some questions about dollar amounts, because
Okay.
you still have to pay people, and us as I work actively in it because of that. So I am certified, because you can't just run it, hire people, pay them. You've got to have a lot of participants to carry all that, just, in numbers itself. And I do this full time.
Mm-hmm.
So it's not a side hustle for me. I hate that term, but you know what I'm saying. I don't do this
Sure.
part-time. So I just have a couple of questions kind of around that. I just want to get them clear in my mind before I speak to one of you lovely ladies. If that's okay.
That is perfectly fine.
Okay, great. And if you have more than one, see, this is the other thing when you say serve a community. I have a bunch. Because the numbers are 1 and 3.
Yes.
So to say, let's put it this way, my philosophy of who I serve is anyone who needs it. Right? And
Right.
so I don't know, for the purposes of the application, there's certain demographics that they really need it, or they lose their employment.
Mhm.
They actually lose their employment if they go tip the scales and develop diabetes. So that's a huge concern. And so that would be, I would like to target them, but you see, it's where, what do the contracts look like? And is there any certain criteria they would have to meet in order to go into this? Because I have never billed Medicare or Medicaid. I have not billed them.
Well, I think we can certainly follow up with you to schedule a different time to talk about your specific questions. But just going back to reiterating, you keeping the control of your national DPP. We're not going to dictate to you, how to hire people or how many people to hire, or we just want you to tell us what you want to do so we can have it documented. So if you want to target, people in transportation or truck drivers, just put that on your application. And then just like you told us, put why, because they're at jeopardy of losing their employment if they develop type 2 diabetes. So that impacts their livelihood. It impacts, their income level, poverty rates overall. So we just want you to tell us what you want to do, which is most important because your community's best.
Right.
Absolutely.
Well, I appreciate that.
Yeah, Anita, and I think sometimes that's kind of the hardest thing that, when grants are issued, is sometimes they try to tell you exactly how to, who you're supposed to reach, period, and so like Regina said, your community best, what works best. That's all what we want you to do, because that's the success of the program. It's not somebody from the outside coming in trying to tell you, oh, put your finger on that spot over there, because that's a need. What's working, what will work, and what doesn't work, right?
Right. Well, and that is the truth of it, and being able to serve and have different folks intermix in a